Welcome to Let's Talk About It Inside the Mind, the podcast where we explore mental health topics through clinical insights and evidence-based practices. I'm your host, Dr. Chambers, and today I am joined by my esteemed colleague, Ms. Darsie King. Together, we will discuss borderline personality disorder, or work with individuals, how they're affected by it, and we extend the conversation to a particularly vulnerable group, adolescents in foster care. Our first segment, understanding borderline personality from a clinical perspective. So, borderline personality disorder, or BPD, is a multifaceted mental health condition that significantly impacts mood regulation, self-image, and interpersonal relationships. Clinically, we see youth who experience rapid shift in mood, difficulty managing impulses, and challenges with relationship stability. Today, we aim to clarify the clinical presentation of BPD and the importance of early effective interventions.
From a clinical standpoint, it is essential to understand that BPD is characterized by a pattern of instability in emotions and relationships. Our work involves comprehensive assessments to identify symptoms such as chronic feelings of emptiness, intense fear of abandonment, and impulsiveness. This careful evaluation guides our treatment planning for each youth.
So let's review the clinical criteria for borderline personality disorder. According to the current diagnosis guideline, individuals may exhibit symptoms such as marked instability, interpersonal relationships, intense episodes of anger, depression, or anxiety, recurring suicidal behavior or self-harm, a persistent sense of emptiness or identity disturbances. Accurate assessments are critical for differentiating BPD from other mental health concerns or conditions, ensuring that our treatment plans are significantly tailored to everyone's need.
In practice, standardized diagnostic tools and in-depth interviews help us form a clear picture of each youth's symptoms. This systematic approach is key in developing individualized and effective treatment strategies.
In segment 3, let us review the evidence-based treatment modalities. So when discussing treatments, evidence-based approaches are at the forefront of our work. Dialectic behavioral therapy, DBT, remains a leading intervention for BPD. It focuses on skills such as mindfulness, emotional regulations, distress tolerance, which are essential in helping the youth manage intense emotions and reduce self-harm behaviors.
Alongside DBT is cognitive behavioral therapy, or CBT. And another cornerstone in our treatment arsenal, CBT helps patients identify and challenge unhelpful thought patterns, thereby promoting more adaptive behaviors. In some instances, adjunctive pharmacotherapy is used to address co-occurring symptoms like depression or anxiety. However, medication is considered an adjunct rather than the primary treatment for BPD.
In segment 4, we look at the collaborative approaches in the clinical practice. Our work with youth often requires a collaborative, multidisciplinary approach. Regular case conferencing or family teams meeting, ongoing training of clinicians and youth workers, and incorporating feedback from the youth themselves to help us refine our treatment protocols. Overall, it is a team approach.
Collaboration among clinicians is vital. By sharing case studies and treatment outcomes, we are not only there to enhance our own practices, but also contribute to a larger body of clinical research. This collaborative spirit ensures that we stay updated with the latest evidence-based interventions, ultimately benefiting our youth.
In segment 5, let us look at supporting individuals with BPD best practices. Supporting youth with BPD requires an environment built on empathy, structured interventions, and continuous monitoring. Educating family members and caregivers is also an essential part of the process. as they often form the primary support network for our youth.
Best practices are going to include active listening, validating the youth's emotional experiences, setting clear and healthy boundaries, and consistently applying our treatment protocols. We also encourage participation in structured support groups where youth can share their experiences in a safe and understanding environment.
Now let's shift our focus to a particular vulnerable group, adolescent youth in foster care. These young individuals often face compounded challenges. The instability in their lives or in their living environments can accelerate symptoms of borderline personality disorder, such as fear of abandonment and difficulties in regulating emotions.
Adolescents in foster care are at an increased risk for developing emotional and behavioral issues. The lack of stable, supportive family environments may intensify feelings of isolation and distrust. In our clinical work, we see that these factors contribute significantly to the presentation of BPD symptoms, making early and specialized intervention even more critical.
Let's consider a case example from our clinical practice. We recently worked with a 16-year-old girl in foster care who we refer to as Becky to maintain confidentiality. Becky exhibited a classical symptom of borderline personality disorder: rapid mood swings, intense fear of abandonment, impulsive behavior. Given her unstable home environment, her condition was further complicated with feelings of neglect and mistrust.
To support Becky, we implemented a wraparound service model. This comprehensive approach included integrated mental health services, which is regular therapy sessions utilizing DBT and CBT, tailored to her developmental needs. Educational support. This includes coordination with her school to address academic challenges and ensure a stable learning environment. Family and caregiver involvement, which is designed for engaging her foster family and case workers in her treatment plan through educational workshops and regular communication. And then community resources, linking her with local support groups and recreational activities to build a sense of community and belonging. This holistic approach provided Becky with the structure and support necessary to manage her symptoms and gradually build her resilience.
Wraparound services are critical for high-risk individuals, high-risk youth like Becky. By coordinating care across multiple domains, clinical, educational, familial, and community, we create a safety net that addresses the myriad of challenges these adolescents face. This model not only supports their mental health, but also fosters a long-term stability. As we conclude today's episode, it is important to recognize that while borderline personality disorder presents significant challenges, especially among vulnerable populations like adolescents in foster care, evidence-based practices and collaborative care model provide a clear pathway towards improvement.
For clinicians, staying informed about the latest research and treatment modalities is essential. We encourage our colleagues to engage with professional development opportunities and participate in collaborative forums to share best practices. Wraparound services have shown promise in addressing the complex needs of at-risk youth.
Thank you for joining us on Let's Talk About It Inside the Mind. For more information, consider consulting resources such as the National Institute of Mental Health and professional journals in psychiatry, psychology, and counseling. We hope this discussion offers valuable insight into our clinical approaches to borderline personality disorder and the unique challenges faced by adolescents in foster care. Ms. Darsie King, thank you so much for joining us at Let's Talk About It Inside the Mind. We hope you will join us in future sessions as we navigate the complexities of mental illnesses.